Hello, this is Dean Laganosky, one of the urologists at MidLantic Urology, and we're going to be talking today through treatments for benign prostatic hyperplasia or enlarged prostate, specifically aquablation. So about my background, I'm one of our urologic specialists who really focuses on complex voiding dysfunction, including treatment of enlarged prostate, overactive bladder, and urinary leakage or incontinence, as well as urologic oncology and minimally invasive procedure options for most urologic conditions. So we're going to start out by talking about what is BPH or benign prostatic hyperplasia. It's important to know that this means an enlargement of your prostate gland. It's very important to focus on the fact that this means it's a non-cancerous, non-malignant condition, and it's very treatable. We have good options, whether they be medication or minimally invasive treatment options, most which are camera-based. It's also exceedingly common. In the US, it affects about 50% of individuals ages 50 to 60. And as we age, up to 90% of individuals are affected over the age of 80 with symptoms related to their urination. There are many risk factors for what causes BPH, including age, genetic predisposition, and sometimes hormone influence. Those of you who have heard me talk on this subject before know that I like this image that kind of demonstrates what a normal urinary tract looks like towards the left. I typically will use the analogy of the prostate gland looking like a ball that will surround the tube that passes the urine. So as that prostate gland is growing, it's pushing inwards and creating a smaller channel where that urine will have to flow. As you look to the left, when that prostate gland gets very swollen, it actually puts a lot of stress on the bladder. And most individuals will get to a point where they will hold on to a degree of urine and then get symptoms including urgency, frequency, difficulty passing a urinary stream, or need for even catheterization. So what are some symptoms of BPH? Quickly, you'll have symptoms related to sudden or recurrent urgency to go to the bathroom. I need to drop what I'm doing and go to the bathroom when I need to. I may have some difficulty starting my urinary stream and also have some starting and stopping of the stream. The stream may seem very weak. In some situations, it may split. Nighttime urination tends to be one of the more troublesome complaints for many individuals. Many men are waking up sometimes 1 to up to 8 or 9 times a night. Painful pushing or straining to have to evacuate your bladder. You're trying to generate a higher pressure to push that urine out against that prostate gland, which is just not allowing you to do so. And then consequently, you will likely start to empty your bladder incompletely. Hold on to urination in the background, which will then drive you to go more frequently. And in some situations, this may weaken the muscle or make the muscles more sensitive on the bladder, causing urinary leakage. There are also some conditions that are associated with enlargement of the prostate gland if it is left unchecked. So things like urinary tract infections. One of the most common reasons for men to get a urinary tract infection is incomplete bladder emptying. So as that urine starts to build up on the inside, bacteria from the skin surface will start to build. And when they build to a certain level, they can start to cause you to feel sick, have fevers, and in some situations can be even life-threatening. Bladder stones similarly form due to not completely emptying your bladder. The sediment that is in the urine starts to compound on itself and starts to form hard calcifications that can cause pain or blood in the urine. In some situations, urine can back up to the kidneys where the urine is made, and it can cause kidney damage or failure, which can sometimes be permanent. Urinary leakage or incontinence can happen, and damage related to high pressures on the bladder can occur over time as well, as that bladder is in a stressed or a strained state trying to push that urine out. It can cause abnormal or negative remodeling of the bladder tissue over time that can weaken it and make it not squeeze as effectively. It's important to note, too, that BPH does not increase your cancer risk. So how do we diagnose BPH? There are many different options that we have here. The initial screening will typically take the form of a few different tests. One, a finger exam of the prostate gland from down below will tell us the prostate size and make sure that there are no irregularities on the prostate that would warrant a different type of workup or looking into that further. A quick straightforward ultrasound of the bladder that's done in the office after you urinate would tell us how much urine you are leaving behind at that particular moment and give us at least some information in terms of the ability to completely or incompletely empty the bladder. That would help with our decision making. Symptom scores. These are questionnaires such as the prostate symptom score that lets us know a little bit more information about what types of symptoms you are experiencing with your urination, whether it be waiting or around to start that urinary stream, or straining to go to the bathroom, a weak stream, waking up at nighttime, and how bothered you are associated with those symptoms. PSA testing is a quick blood test that looks at prostate cancer risk and is one of the initial screening evaluations for that. And then urine testing can be conducted that will look at not only infection or bacteria in the urine, but any signs of microscopic blood or other irregularities such as inflammation that you may not be able to see with your own naked eye. Other tests that we utilize are pressure flow studies. These tend to be very, very helpful for determining how your bladder is functioning. This is a UroCuff or a UroFlow, UroCuff being kind of the newer version of this. It's a non-invasive cuff that squeezes with some smart resistance against the way that you pass your urine. And it basically works out the bladder and tells us how well is your bladder functioning, what is the squeeze looking like, and what is the flow parameter at a couple different points to give us a better idea of how compensated your bladder is squeezing against that prostate gland, or if there is something else going on that we need to be considering. Urodynamics testing is a bit more detailed version of some of the UroCuff or UroFlow that gives us some more in-depth information on the voiding pattern. This is comprehensive, takes about 45 minutes to do, but does require a brief catheter to kind of fill up the bladder and then read some of those pressures. And then we have some other advanced testing that would allow us to look at the anatomy more directly. Cystoscopy is a quick camera look, takes about 1 to 2 minutes. There's no incisions to do this. We use a camera to pass this backwards through the tube you pass the urine out of. This is very helpful because it really provides the most direct look at the anatomy to say, listen, this is the size, the shape, the contour of the prostate gland. And how is that prostate affecting the outflow tract or the urethra? Where is it blocking, or is there something else going on like a stricture or an obstruction from another source on the urinary tract? It also can help to look for other things that may be causing your urinary symptoms, such as stones developing in the bladder or tumors or irregular tissue. It can also look for sources of infection or bleeding within the urinary tract, and then look at other kind of strain pattern or irregularities on the bladder tissue. Diverticulum is basically a thinning or an outpouching of the bladder, and trabeculation shows a strain pattern on the bladder for when your bladder has been squeezing hard against that prostate gland over time. We can get an idea of how significant that change has affected it. And so other additional tests that we sometimes utilize is a ultrasound that will look and size the prostate gland done through a transrectal approach. This would help us to look and accurately size the prostate gland for determining what types of treatments may be most helpful to improving your urination or symptoms that you're experiencing. And then the prostate needle biopsy is really most indicated if we have a high suspicion of any cancerous process or we need to rule out a cancerous process in the prostate gland. This involves small needle puncture samples of the prostate tissue and really is considered more for abnormal PSAs or irregular rectal examinations, not necessarily part of the workup for an enlargement of the prostate gland that is otherwise benign. So in terms of ways that we treat BPH or enlarged prostate gland, we're really looking at a couple different options here. You have things from lifestyle modifications or changes, avoidance of certain types of medications that either help to relax your prostate gland, like the alpha blocker medications, or can somewhat shrink your prostate gland, like the 5-alpha reductase inhibitors, or some other kind of secondary medications that may cause a dilation or relaxation effect, such as tadalafil or Cialis on the prostate gland. And then we have procedural options, which we'll go into a bit more with a real focus on aquablation today, which is one of our kind of newer, most sophisticated technologies for addressing symptoms related to your enlargement of your prostate prostate gland. For more detailed information on some of the other options, I did previously record a webinar on BPH management that would give you a little bit more of a comprehensive overview. So make sure that you check that out. It's on the MOU webpage on my profile, Dean Laganosky. So we're going to go into a bit more detail now about one of the specific treatment modalities that has become more and more popular to let you know what this entails and answer some questions related to this technology, aquablation. So aquablation, again, can be indicated for individuals who are, one, not interested in long-term medications. Many of the medication options we have are meant to be maintenance medications, meaning that if you come off those medications, your symptoms will slowly get back to where they were before. And in some situations, medications may not completely get you to a better baseline in terms of your urination based on some of the features or anatomy that are at play, or they may not be able to progress you to the point where you're reaching your goals for your urination. So some of the testing that we looked at before can really help us to determine, is this an appropriate treatment option for you? This is basically a heat-free water beam that is like a power washer, and it vaporizes the prostate tissue in a very precise, robotically controlled fashion. The precision is on the order of millimeters, and the goal is to create a nice wide channel where that urine is going to flow instead of having that prostate gland standing in the way of that urination. The other benefit of this is it's heat-free. So some of the older modalities where we really have to cauterize or char on the inside of the prostate gland is basically mitigated with this newer technology. And it's very effective in terms of removing a great deal of the obstructing tissue while still preserving a lot of the other structures that are very important to men, such as the ejaculatory ducts or the urination control mechanisms. So it's image guided. We look at this with an ultrasound, which we'll show you in a bit, and also direct visualization with a camera from down below. It's incision free, so it's all camera based to do this. It's heat free, which is beneficial for the reasons we talked about. And your surgeon or specialist is really controlling that robot in a very precise fashion. This technology, look, I'm a very efficient resectionist with some of the other types of procedures we have. This type of technology really does what I can do, even on a good day, much better and much more precisely than a human hand can control. And it typically cuts procedure time down as well. It does typically require general anesthesia, so a sedation to make sure you're nice and still for when we map out that prostate gland, making sure that we're treating the correct zones. And it does typically require an overnight stay in the hospital to help to flush or rinse out the bladder, to make sure that everything is nice and clear and that the ablated tissue is being pushed out. So here are some before and after images of aquablation. And I always think this is a really striking set of images when patients are consulting with me to show them, which is basically at the top left portion of your screen, you have a direct camera-based view of what your prostate gland looks like when it's causing a blockage at the beginning of the aquablation procedure. So you have your two sides of your prostate gland pushing inwards and creating only a very small channel where that urine can flow. Also, on the ultrasound image, which we are directly looking at during the procedure in real time to map out that prostate gland, you can see that that prostate is really constricting the channel where the urine is flowing, and there's not much room for that urine to escape. We can map out this aqua beam or water vaporization of the prostate very precisely to the contours of the prostate, using a direct image on the ultrasound, and then that guides the robot to really help to vaporize that prostate gland precisely for where we need to have that happen. You can also preserve some of the zones, such as the verumontanum or the ejaculatory ducts, that surgeons are typically focused on to try to preserve your ejaculatory function in the most meaningful fashion, and much more robustly than we could with some of the older technology. And then we have our after images here, which is basically when you take a look back in with your camera, you can see you have a nice direct channel through that prostate gland, a wide channel where that urine is going to flow very easily. The bladder is not going to have to work as hard to push that urine out, and the bladder can start to settle or de-stress itself over time. And then you have the ultrasound image, and this is actually directly after the ablation occurs. And in real time, you can see the clear channel that you've created with this Aquabeam. It's really amazing. So the before and the after is always really striking. And that's your new channel where that urine is going to flow very effectively while still enabling you to control the urine. So a bit about aquablation, the risks and the side effects. Most individuals are going to experience, like other treatments for enlarged prostate that are camera-based, burning with urination, urgency to go to the bathroom, or urinary frequency. This is typically most pronounced over about 1 to 2 weeks post-procedurally. Most individuals will have some blood tinge to the urine post-procedurally as well. It may appear as a pink or a red tinge urine. We typically will seal everything up at the end of the procedure, and then run some fluid overnight in the hospitalization to kind of clear the urine even further. And there is a very rare risk of any damage to the surrounding tissues, primarily because we are so tightly controlling this device using that robotic instrument and directly visualizing both with ultrasound as well as a camera. All the studies have shown that there's essentially no impact on erectile dysfunction or orgasm sensation. Nearly all men with this type of procedure can also preserve their ejaculation, primarily because we can model this plan for vaporization of your prostate gland so tightly to avoid some of the structures that are responsible for that. And about 99.9% of individuals do not experience incontinence with this for a similar reason of our tightly robotically controlling where this Aquabeam is going. Typical catheter need in most of our hands is between 3 and 5 days post-procedurally. When you are discharged from the hospital, typically sometime midday or mid-morning, the day after your procedure, we have you set up with everything you need to know to go home with a catheter to a leg bag. When the catheter gets full, you will open that up and empty it. We will have an appointment set up for you to do your voiding trial after that defined period of time. Most individuals after that are voiding very freely, even individuals who come who are requiring a catheter or can't break the cycle of a catheter preoperatively. This other benefit of this procedure is it is size agnostic, so meaning that any size of the prostate gland can be treated with this technology and still very efficiently. So even very big prostate glands, where we previously were treating this with an incision or a abdominal robotic surgery, are candidates to have this type of surgery, which can really help to clear a nice wide channel very effectively through even larger prostate glands. So most individuals, and you can look as well at very good resources online to hear testimonials about this, but most individuals who go forward with aquablation find that there are a lot of favorable aspects of this comparatively. It basically utilizes, you can see here in this testimonial, a lack of heat, which can make a big difference in terms of kind of healing from these types of procedures, and also, not having any undesirable spread of cautery to the surrounding tissue structures. And then, it's very tightly controlled in the robotic surgeon's hands here to really make sure that we are precisely treating the tissue that we want without treating the tissue that we don't intend to. So remember, aquablation is just one BPH treatment. As you come and see a urologist in our offices, we're really focused on tailoring what is the best option for you as an individual based on all the types of considerations that we're looking at, the diagnostic workup, what your goals are. So this is a conversation to have with your treating provider. But it is a very good option. It's a very sophisticated technology that can get the majority of individuals, if not every individual, to where they need to in terms of urination. So it's important that you meet and you work with your provider on finding what the right solution is for you. And so again, I typically end this talk and most of my discussions and presentations with the fact that it's so important to partner with your specialist. If there is something that is bothering you, whether it be urinary symptoms or otherwise, get checked out. Partner with your provider and allow us to help you to live a healthier life and to help to make decisions with you to make sure that we're keeping you healthy for years to come. So thank you for taking the time to talk through BPH treatment and aquablation with me today. We'll look forward to seeing you in our offices or if you need anything going forward.